ABC 15 Daybreak.
It is 5:15. We do have a health alert for parents this morning. Doctors are telling us that kidney stones are affecting more of our children. So what can you do to prevent them? ABC 15's Brian McElhatton is live in Phoenix working to keep your family healthy. Brian, how common are kidney stones in children? Good morning.
Good morning to you, Connie. It's still not quite as common as they are in adults, but over the past decade, doctors have seen a twofold increase in the number of cases of kidney stones affecting children. And these are what the stones look like. You can have a single stone, you can have multiple stones, but they do have the consistency of pebbles you might pick up off the ground. Incredibly painful for those things to pass through if you've ever known anyone who's had one. I want to introduce to you Dr. Mark Hahn, of affiliated urologists here in Phoenix. You treat these cases all the time. You know what they're like. The biggest cause of these, dehydration. We're not getting enough water. Our kids aren't drinking the right stuff.
Yeah, that's right, Brian. It's very difficult to actually drink enough water to prevent these kidney stones, and that's a big deal here in the desert.
And you brought some water. How much water should we be drinking? Right?
Well, you know, these are just your normal water bottles that you can pick up at Costco or wherever else. These have 500 milliliters each. That's about 4 cups. We, as children, of course, children need to be drinking from ages up to 5 years old, at least 1 to 2 of these a day. Above 10 years old, probably about 2 to 4 of these a day. And of course, as adolescents going into adults, because adolescents are basically like small adults, you need to be drinking about 5 to 8 of these a day.
Sure, and we have some graphic to show you that's got all the other causes of kidney stones as well. Diet and obesity, another big one. We're not eating the right things, at least our kids aren't.
Oh yeah, we've got an epidemic going on in the United States right now. It's an epidemic of obesity, not just for us adults, but also for children. And it turns out we've also got an epidemic of salt. There's a lot of salt in pretty much everything we eat. Anything that becomes prepackaged, anything that's in a box, in a can, has a ton of salt. Start reading those labels. But we know that salt definitely can form kidney stones, along with dehydration, and of course, if you're obese, that has some complex factors that can help you form stones.
Sure. Dr. Mark Hong with affiliated urologists, thank you for being with us. We appreciate it. There's a number of other causes, too, for kidney stones. We'll talk about those coming up in about an hour, Connie.
Yeah, the electrolytes on that list perked my attention. I'm looking forward to hearing a little bit more on that. Thanks, Brian. We'll see you in a few minutes.